why you push so hard for the Medicaid expansion?
Well, look, I have a chance to bring $14 billion of Ohio dollars back to Ohio. And, you know, unfortunately, I happen to know how they spend money in Washington. And so I wanted to get it back here. For what reason? To free up local communities to be able to do the things that they've wanted to do and haven't been able to do, which is to treat, you know, through the Adams boards, the alcohol, the drug abuse, to provide more services to the mentally ill. We got 20% of the people in our prisons are mentally ill. I mean, you know, you think about that. You know, locking somebody up who's bipolar, it's unconscionable. And by the way, it's also helped our hospitals. Somebody told me the other day that Cleveland Metro's bond ratings have improved now because their bottom line's improved because we don't have people going in that can't pay their bills. And you also wanted to develop a system here where you have a coordinated kind of health care so that people aren't ending up getting care that they can't pay for, that we pay for, when they're even sicker than what they, you know, than what they needed to be. You know, it's sort of funny. You know, I'm here talking to you about, you know, I guess endorsements, whatever. You just got to understand, it'd be hard. I'm the farthest thing away. I'll call myself the greatest sinner in this room. But I can't honestly look at somebody who is down and hurting and alone and not do something to help them. Now, I want to see personal responsibility out of people. I want them to try, and that's why we're doing this welfare transformation. I don't know if I mentioned that. I mean, we're trying to put the training, businesses, right there smack dab in the welfare office. And this is going to be our new big way, so that, you know, when people go there, they're treated holistically and they're given an opportunity to better themselves. But I can't look at this stuff and just say, you know, we got this money, and I haven't heard one good reason why we shouldn't take it. This, frankly, is just either purely ideological or political. And, you know, we will be able to show you here soon a lot of the examples of where things have dramatically improved as a result of this. Now, the Fed set this thing up. You know, it's 3 years, you know, we don't have to pay anything, and then it's 90%. And I made it clear if they start changing the rules, then, you know, we have to, you know, the deal's off. We just don't know what that's going to be, if that's going to happen. But in the short term, to say no was never an issue for me. And I just, you know, I pled the case to the legislature, and, you know, at the end of the day, frankly, I think they wanted it to go the way it went. I mean, I was able to be able to work the autism through where they didn't have to vote. You know, if you know sometimes how this stuff works, I'm sure you do. Sometimes the members of the legislature would rather just see things happen without having to vote on it.
Has there been any change of heart in the legislature about that, or?
I think you'd have to have a heart of stone or a very hard heart not to understand the changes that have come that have been really positive.